No? Okay. My name is Emma, and this is my second lab assessment video, and Mr. Filey has assured that there is no notes in the room, so we will begin. Before anything else, I would have checked the charts, washed my hands, provided for privacy, and then obtained 2 patient identifiers. Hello, my name is Emma. I'll be your student nurse today.
Hi.
Can I ask you your name and date of birth?
Christina Anderson, 3/24/74.
And according to her identifying bracelet, that is correct. So, are we here for just a chest exam today? Alright, so I'm going to start with the cardiac. And, okay, let's start with inspection. My bad. So, her chest looks even. It's distributed evenly. There's no redness or bruising. The color matches the rest of her skin. Can you sit up and that a little bit? Her ratio is 1 to 2, which is correct. That's normal. Okay. We'll measure it anyway. It's 1 to 2. Okay, can you lay that down?
Mm-hmm.
And then we're going to palpate for crepitus on the chest. Alright, there were no lumps, nodules, or crepitus, which would be air trapped underneath the skin, on her chest. So, and then I will go ahead and palpate, and then we'll listen. Or percuss. I'm going to percuss. Alright. Can you just yeah. I'm kind of backwards on that. Okay. Alright, there were no abnormal sounds. There were resonance underneath her clavicular line. And now we're going to auscultate. Can you just take your head back for me? We're going to start at the substernal notch. And then we're going to move down to the angle of Louis. And then to the right in the second intercostal space. S1 and S2 are clear. There's no murmurs or there's no friction rub. And then to the second intercostal space. And then to Erb's point in the third intercostal space. I'll just have you lift a little bit. Right. And then to the fourth intercostal space. And the fifth in the midclavicular line. None of the locations presented with a friction rub, a murmur, or a gallop. The rhythm was regular, and S1 and S2 were audible. Okay, so can I have you sit up? Okay, hold on. Maybe I'll come over here.
Okay.
Just to make sure that they can see. Okay. Can you turn to the side a little bit? Alright, I think that should be good. Okay, so first is inspection. Her skin is clear. The color is appropriate for her ethnicity. It seems to be even and regular. There's no noticeable lumps or nodules. And then I'm going to use T10 by finding her shoulder blades to assess her breathing. Go ahead and take a deep breath. Okay. The expansion was even. Yeah, the expansion was even. And then I will palpate for any crepitus. Okay. And then I'm going to percuss the lung field by locating C7 and then coming over above the scapula. Alright. I also forgot to do tactile fremitus. So, first off, there was resonance and it decreased slightly as we went lower, but it was still appropriate. And then for tactile fremitus, I'm going to use the same indicators with C7 and T10. And can you repeat 99 for me?
99, 99, 99, 99, 99, 99, 99, 99.
It was appropriate. Her voice vibrations could be felt more exceptionally at the top, and then they diminished as they went lower, which is normal. Okay, and palpate for crepitus, percuss, and then auscultate. Okay. We are going to auscultate her posterior lung fields. And, yep. Thank you. Alright. I'm going to use C7 and move over above her shoulder so that I can hear the apex. Deep breath for me. Okay, and we will do the same on the other side. Alright, Auscultation of the posterior lung fields proves that there was no wheezes or crackles, no rhonchi. She had clear lungs in all fields. Then can you lay back down? Yeah. We can just keep it right there. I'm going to palpate for the carotid artery, one side at a time. Okay. Now I'll use the bell of the stethoscope to listen to that side. Alright, there are no bruits in the carotid. And then I'm going to lay her flat to check for a jugular vein distension. And then we will raise her up at a 45-degree angle. Okay. And there is no jugular vein distension. Is that comfortable? Have you had any problems with your lungs lately?
No.
Has your chest felt tight at all?
No.
Any pain in your chest?
No.
Does deep breaths hurt?
No.
Are you sensitive to cold?
No.
Have you felt your heart racing recently?
No.
Have you felt like pressure on your chest?
No.
Alright, now I'm going to assess the peripheral arteries, and we'll start with the brachial. It is present in +1. Radial artery is present in +2. And for the iliac artery, I would be checking right here, right above the, right midline to the iliac crest. And then the femoral, I would be checking the inside of the thigh. And then, there we go. Oh, yeah. It's alright. More convenient for me. Hair distribution is even on both sides. It takes me forever to find this one, I'm sorry. Okay. It is present in +2. And then the dorsalis pedis. Present in +2. And then the posterior tibial. Present in +2. Normally we would do it on both sides, just to check to see if there's any abnormalities. She has no swelling or edema. And then to check the capillary refill. Oh, we probably couldn't see that last part then. Okay, So I verbalized it, but since the computer was not facing correctly, I checked for the dorsalis pedis right here, and it was present +2, and then the posterior tibial right here, and present +2, and then to check cap refill. All right, it's underneath 3 seconds, so it'd be brisk. And then can I check the cap refill on your hands? Because she has nail polish on, we look at the skin right underneath to the sides, and it was present and brisk. So have you had any irritation in your lower limbs?
No.
Have you felt any abnormalities?
No.
Is sensory perception still available? Okay. Have you had any pain at all in your chest?
No. I've been fine.
Have you had any wheezing?
No.
Drainage?
No. I've been lucky so far.
Alright, oops. Once again, we forgot to turn it. Okay. Do you have any questions?
No.
Alright, and that is the end of the second assessment video. Thank you very much.
Thank you.